Hello, my name is Brittany Page and I'm a licensed physical therapist and the Director of Senior Care Services for H2 Health. Today we're looking to provide assisted living facility administrators and their staff a new perspective on how to identify residents' peak fall risk time and what to do about it. When we take a look at fall risk factors and high-risk groups for falls, you'll notice that there's a lot of overlap with other lists including common comorbidities and the most common demographic living in assisted living facilities. I guess what we're trying to say is we understand that this inclusive criteria most likely encompasses the majority of your building. Although it's important for you to know this information, it may not be helpful in narrowing down which resident really needs you and your staff's increased attention at a given season in their lives. So let's narrow it down a bit. Which resident is in a peak stage for falls? Well, the new resident is. Change is hard. How many times have we heard this saying? This statement reads especially true for the aging adult. The resident may enter your building confident of their ability to walk with an assisted device. However, it's unlikely that that resident's previous home had 200-foot hallways. The increased walking distances will be new to them, even if their assisted device is something that they've been using for quite some time. Navigating new spaces, such as the dining room and getting on and off elevators, this is also going to be new to them. I'd be willing to bet your resident hasn't been stuck in a resident traffic jam lately on their way down to the Friday night happy hour event. Each one of these major changes places your resident, that new resident, at his or her peak risk for falls. The resident that has gone through a recent hospitalization and discharge. This particular resident is definitely in their peak season for falls. There are probably medication adjustments or changes in distribution times. This can lead to increased confusion and dizziness with your resident. Not to mention fatigue from lack of sleep, and then that transition back into an environment with updated medical equipment and different needs. So remember, the recently discharged resident is definitely in peak stages for falls. A recent fall resident. How many times have you heard the story, Mrs. Jones has never fallen and now she's fallen 3 times since Sunday? Why is that? Well, there's a lot of factors that can contribute to falls. And later on in the week, we're gonna be posting another video to kind of tease them out. But for now, it's important to drill home to your staff. Previous falls are a predictor of future falls, but it also leads to a fear of falling. Over here on the side, you're gonna see what we call the fall cycle. And that includes that idea that you fell and then you have a fear of falling, so you reduce your independence, which reduces your functional ability, which is gonna lead to more falls. And even though we experience this typically over a period of time, there is a reason why they may have fallen in the first place. So first we wanna look at those environmental factors and make sure that we're setting our resident up for success, but just know and keep in mind to your staff that previous fall or a recent fall makes them in a peak season for future falls. Changes in an assisted device. How excited are you to see Mrs. Jones walking again? I know I am. You know how hard she's been working with her physical therapist, and she's finally been released to hit the streets with that fancy new rollator of hers. This is awesome. We know as professionals that a healthy building is a stable building. And a stable building can give back to residents all kinds of resources they may not otherwise have access to. However, this is a peak fall risk season for Mrs. Jones's life. Think of her as a new resident navigating the building from a different perspective, but for the first time. I want to point out, it isn't the change to a more independent device that places Mrs. Jones in this peak season. It's the change itself. So we also have to address the resident that has recently been transitioned to a more dependent device. An example would be if that resident went from a rollator to now in a wheelchair. There's just as many new things to learn and adjust to with this transition as the previously mentioned one. And last but not least, we're hoping your building has fully integrated therapy services and that those clinicians are in close communication with you and your staff. If not, we encourage you to build these close relationships with your home-based therapy providers. These people are going to serve as the extra eyes and ears for you when it comes to medication changes, assisted device changes, and other risk factors. So thank you for listening in, and we hope you find this information helpful. My name is Brittany Page with H2 Health. And I want to ask the question, what have you done today to create a better tomorrow?